Yeah, people, welcome to my YouTube channel. Thank you to all my subscribers, viewers, and listeners. Trypanosomiasis is a parasitic vector-borne neglected disease of the world. This means it is transmitted by an insect to the humans. It is of two types, African or sleeping sickness or American or Chagas disease. African is transmitted by tsetse fly and is further divided into West African and East African caused by Trypanosoma bruceigambians and Trypanosoma brucei species respectively. Trypanosoma bruceigambians causes 90% of all trypanosomiasis. The vector of American trypanosomiasis is triatomine fly and the parasite is Trypanosoma cruzi. There are three stages of African trypanosomiasis: cutaneous, hemolymphatic, and CNS involvement. Chagas disease may cause fever, headache, cough, swelling, abdominal pain, heart failure, arrhythmias, dysphagia. Diagnosis of sleeping sickness is by thick and thin films, whereas Chagas disease can be detected by blood smears, ELISA, PCR testing, RIPA, or TISA blot. Treatment of African trypanosomiasis depends on the stage of disease and type of protozoan and may include suramin, pentamidine, fexinidazole, nifurtimox, eflornithine, Benznidazole and nifurtimox can be used to eliminate Chagas disease. Trypanosomiasis can be serious if detected late or left untreated. Trypanosomiasis can be transmitted vertically. Preventive tips are: wear protective neutral colored clothes, inspect vehicles before sitting, stay away from bushes, and use DEET insect repellents. Take loads of care and keep all the sick patients in your prayers.